Hi, my name is Lindsay, and I'm going to speak to you about addiction, cigarette smoking in particular, in hopes that you'll find just another reason to quit smoking cigarettes. First, I want to speak on addiction. According to the American Psychological Association, addiction is a chronic disorder in which affects us biologically, psychologically, socially, and even environmentally. So I want to speak to you about some of these factors as it relates to our health and addiction of smoking cigarettes. One of my first wake-up calls when it comes to smoking cigarettes was when I was about 24 years old while I was working as a medical assistant. I was asked by a doctor to chaperone him into a room while he did a breast exam on a patient that was a female. During the examination, he goes on to ask her about any history of smoking or any family history of cancer. She did admit to smoking cigarettes. Although she had no family history of cancer, he went on to tell her that along with cancer, smoking cigarettes can also weaken your gums, which will eventually make your teeth fall out. When he told her this, she started to laugh, and it was kind of shocking to me and the doctor, because we was wondering, like, why would she laugh, you know? Then she proceeded to pull out her dentures, you know, and we realized in that moment that it was too late for the speech that he was giving her. It wasn't too late for the cancer part of it, but her teeth was already missing and gone at the age of 40 years old. Just imagine just having dentures at 40. So after that, I realized that the first step to persuade anyone to do anything is to educate them on the risk and benefits of everything, and make sure that my patients are informed about decisions that they are making concerning their health. After that experience, I had another eye-opener when I was at work, and I had two former co-workers die that was very unexpected. You know, their symptoms went from a simple cough, and you know, and then it went into full-blown lung cancer, and both of them were diagnosed and died within 6 months. I attended both of their funerals because not only was they my co-workers, but they were people that I see more often than my own family, you know. So that was very hurtful, and that changed my mind about everything, about when it comes to tobacco smoking, and just even thinking about smoking myself. I was completely against it from that point on. So I want to be able to save somebody else from that heartache of death, you know. Not only that we have to suffer, but they have children and grandchildren and even husbands they left, you know. Most of the time when we speak, when I speak to people about cigarette smoking, most of the time they tell me it's just an addiction. It's something I'm used to doing. It's a habit. Or they'll just say that it relieves stress, you know. Most people have heard of the major diseases caused by cigarettes, such as lung cancer, emphysema, and your increased risk of heart attacks and strokes, mainly because it's right there on the pack. But I am going to focus on a couple other things that shocked me about cigarette smoking and the effects of it, besides the physical health deterioration part of it. And I want to convince you to, you know, find other reasons to stop smoking cigarettes. Did you know that smoking could actually stop you from gaining employment? And since 2013, it's been a new law out that the hospitals have enforced a rule, and it's called the tobacco-free policy, where when you go to put an application in, you have to basically say that you do not smoke cigarettes and you have not smoked cigarettes in the last 30 days. If you do not say yes, you cannot proceed with filling out the application for employment. They claim that cigarette smoking and secondhand smoke contribute to over 400,000 deaths a year, and billions in healthcare costs and productivity. One of the examples they could be talking about is, well, I had personally witnessed employees taking multiple breaks just to satisfy their addiction, you know, and they also subject other employees and clients with the unpleasant smell of smoke, you know, and it can be bothersome, especially for somebody who suffers from asthma, COPD, or, you know, just any type of respiratory condition, you know. because the smell lingers on their breath, their hair, and their clothes. You know, not to mention providing health care and health insurance and life insurance for smokers is higher than to provide it for people that do not smoke at all. Which leads me to another law that was put into place a few years ago. According to NBC News, which is interesting because 2016, the cost of cigarettes went up $1 because the cigarette tax increased. And when they increased it to $1, it made Pennsylvania cigarette tax the 10th highest in the nation. Currently, a pack of Newports can cost over $10 a pack, depending on where you buy it from. But if you smoke one pack a day, that's $3,600 a year. When you think about it, it's $300 a month and $3,600 a year. Could you just imagine what you could be buying with that money, what you have been saving for, a vacation that you may have wanted to go on? You know, cigarettes contain nicotine, and what nicotine does is it causes your blood vessels to constrict, and it limits the amount of blood flow to organs such as your heart, your eyes, and even your penis. This is another thing I tell some of my male patients when they complain of male erectile dysfunction, is that your penis consists of many blood vessels, and they normally dilate when you are excited sexually or aroused sexually, and when you smoke cigarettes, these blood vessels won't dilate, meaning they won't open, they will stay closed, and this will lead to an ability to achieve or maintain an erect penis. And this can affect your marriage, this can affect any relationships, you know. In closing, I would like you to think of how smoking affects you and your family. How can it affect your future? I want you to write down some personal positives and negatives of smoking, such as how much money you can save and what you could be spending that money on, such as taking a vacation with your family. And I want you to convince that I want you to know that you are strong enough to do this. And there are, you know, counselors and quit lines that you can call, which one of them is 1-800-QUIT-NOW, and you can talk to somebody that's trained to help you. You know, they can also provide you with other aids such as patches or gum or even lozenges that gives you nicotine but it's lower amounts before you quit cold turkey, you know, which can be hard because you will be withdrawing from the nicotine. But if you can get the gum, which is lower doses, it can like wean you off slowly instead of you just stopping cold turkey, you know. And this quote stuck to me, and I looked it up, and it's called it was by an American psychologist. He's also a good writer. His name is William James. He said, if you can change your mind, then you can change your life. And that is something that can help all of us, changing our minds. Thank you very much.